Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a presentation by a GP on group appointments. You now have 90 seconds to read questions 31 to 36.
Hello everyone. My name is Maxine Williams and I'm a GP who works at the Parchmont Medical Centre in Surrey, where we have started a new way of seeing patients. This new way involves a GP seeing several patients together in one group session. While this may seem strange at first glance, it is something that we decided to try because of the increase in demand for appointments at our practice. An interesting statistic is that in recent years, the number of GP appointments has risen by about 13%, but GP numbers are up less than 5%, which means that GPs are working more and more hours to see all the patients that need an appointment. Burnout among GPs is a very real problem. Another factor increasing GPs' workload is the fact that many of us are living longer and with multiple long-term health conditions, which can make consultations increasingly more complex. We can say without a doubt that the traditional one-to-one 10-minute appointment no longer works for many of our patients. Without increased funding or a substantially increased GP workforce, primary care teams have to find innovative, new ways of delivering routine care in general practice that simultaneously save time and improve quality, which is what led us to the idea of seeing multiple patients at the same time. I will give you an example of how this might work in the real world. I had a patient who had reached 50 years of age and had a few diagnosed health issues, problems with weight and blood pressure, so it was definitely time for him to come to see me. However, when he came in for an appointment, instead of having the usual 10 minutes with me, he had an hour and a half with a GP. But he didn't see me, the GP, alone. He shared his appointment with 6 other patients who all had weight issues and/or had been diagnosed with pre-diabetes. Group sessions can include as many as 15 participants. Our group sessions start with a doctor's assistant or facilitator collecting the patient's measurements and compiling a list of questions the patients want to ask the doctor. Depending on the group, some test results, such as body mass index, will be written up on a board in the room so that the GP can lead a discussion around them. In the case of the group previously mentioned, I, the GP, also led the group in a discussion of sensitive issues such as gut problems and patients' relationship with food and their overall mental well-being. I think for many of the patients, it was the first time that they had had a chance to engage in this type of in-depth conversation with a GP. The objective of the group sessions is to give patients more information about their condition because they can learn from the doctor as well as from each other. This helps to ensure the GP's time is used efficiently, and it also results in patients feeling more empowered. Many people think that it would be constraining to have other people in the room, but that is not what we have found when we have asked patients about their experiences with the group appointments. The patient I mentioned before said it was quite the reverse for him, and that once the group got going, a bond was formed and everybody was quite open. This bond that forms between patients with the same diagnosis is the real strength of the group appointment. Managing long-term health conditions such as obesity and high blood pressure can feel overwhelming for patients, so offering more access to a patient's GP along with a valuable peer support network can bring real benefits in the long run. However, if the idea of discussing your medical condition with a group of strangers still seems off for you, we also continue to offer patients the option of traditional one-to-one appointments if they wish. In addition, one-to-one appointments will still be the first step for patients who don't already have a diagnosis. Diagnosing someone in a group wouldn't be appropriate. Finally, another good reason to continue to offer traditional appointments is for patients who are concerned with confidentiality of their health information.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a researcher being interviewed about a new class of cancer drugs. You now have 90 seconds to read questions 37 to 42.
Welcome everyone to our programme, Health Now. I am very pleased to have with us here today Dr. Kevin Gallagher, a cancer consultant at the Royal Marsden Hospital. Tell me, Dr. Gallagher, how are you today?
I'm doing quite well, and I'm excited to be here today to share with you a revolutionary new class of cancer drug that can be used to treat a wide range of tumours. It is the first drug of its kind to be approved for use in Europe, so we are excited to talk to the public about it.
That does sound quite exciting. Tell me, Dr. Gallagher, I've heard the term tumour agnostic. What does that mean exactly?
Tumour-agnostic drugs do not care where the cancer is growing in the body, so long as it has a specific genetic abnormality inside. This approach has the potential to cure more patients and cut side effects.
Why is that exactly? How does it know where to find the cancer?
Well, our previous approach was to treat breast cancer or lung cancer. But with this type of medication, we are moving towards precision medicine that can take advantage of the genetic makeup of each patient's tumour instead of targeting an area of the body for treatment. This treatment targets the abnormality and uses biochemical pathways that are common to many different tumour types.
So you said that this is the first drug of its kind approved in Europe? Does that mean that it's available to everyone at this point?
No, not quite yet. The decision of European regulators does not mean it has been made available for all patients in the United Kingdom. First, the NHS will need to ensure that the right genomic testing is available across the country to identify patients who could benefit from the treatment.
Can you give us an example of a case from the UK where this new treatment has been used successfully?
Yes, of course. We recently had a little girl named Charlotte. She was diagnosed with infantile fibrosarcoma, a cancer of the body's connective tissue. Her parents were informed of this new treatment option, and they accepted it in part because they knew that their options were so limited. Now to the more technical part. Charlotte's tumour was caused by a genetic abnormality known as NTRK gene fusion, meaning that one of her DNA accidentally merged with another, and the alteration in the blueprint of her body led to the growth of her cancer. It is worth noting that while this type of gene fusion is quite rare, it is not unique to sarcomas, Charlotte's type of cancer, but it also appears in some brain, kidney, thyroid and other cancers. This means that the same medicine that was successful in this case can be used across a wide range of cancers. Also, it is particularly exciting that we have found a treatment for this particular type of cancer, because when NTRK fusions were first discovered back in the 1980s, there was a widespread fear among researchers that they couldn't be treated with drugs because the NTRK genes play critical roles in the development and survival of nerve cells, which raised the possibility that altering the genes could cause dangerous neurological side effects. Future research has obviously shown that those fears were unfounded.
So how is little Charlotte doing today?
Oh yes, she's doing great. Her parents report that she is busy making up for lost time, and she's now leading a relatively normal life.
How exciting! So can you tell me a bit more about the drug itself? What are the side effects?
Like I mentioned before, the side effects reported during the initial trials included mild fatigue, dizziness, and digestive issues. But for the most part, the drug was remarkably well tolerated.
OK. And what about the effectiveness of the drug? Does it work on all patients?
Well, no drugs work on all patients, but based on data from studies from America and Europe involving patients with NTRK fusions who had run out of treatment options, this drug produced a 75% overall response rate across the range of tumour types that I mentioned earlier. Of those responses, 39% lasted a year or longer. Now, those were studies focusing on adults. Studies focusing on children show that they respond even better, with an overall response rate of 94%. More studies are underway to determine.
That is the end of Part C. You now have 2 minutes to check your answers.